Hello viewer, welcome to today's episode of Health Talk Show. We are still on dental health, oral health, which is a matter that affects the children, the middle-aged, and also the elderly. We had a very beautiful discussion last week. We were able to understand how to take care of our teeth and also understanding the growth and development when it comes to oral health. Today, we are going to discuss some of the problems, danger signs that people should be alert when it comes to oral health. My name is Lucy Wanzakaryuki, and we have a beautiful guest in our house who was also with us last week. And to our guest, welcome to the show and kindly introduce yourself.
Thank you, Lucy, for hosting me.
Yes.
My name is David Amenya. I'm a dental officer working at Great Dental Center based in Kasarani constituency along Kasarani Miki Road. Thank you.
Welcome to the show.
Thank you.
We would like you to tell us some of the things that we should be considerate of. That's some of the warning signs which should be able to be monitored during the growth and development of teeth. What should worry a parent? What should worry a caregiver when it comes to children and dental health?
Thank you, Lucy, once again. For the children, the young children, we normally advise the parents, even the guardian, when you see the danger signs, like the child normally takes 2 hours, 1 hour to eat. The child, when they swallow, they have difficulty in swallowing.
Yes.
When they have a drink, tea, or something cold, the child cannot be able to drink very well. They have a lot of, they're pushing away.
Yes.
When you see a child distancing themselves from other children, they are not playing. When you see the child cannot be able to talk well, those are the signs that makes you as a guardian or a parent to be very concerned to know exactly my child is going under a stress or a certain condition in his or her mouth.
Yes.
Yes.
What about swelling and fever? We've seen people take their children to the clinic complaining that it is all about dental problems, teething problems, and as early as 2 weeks post-delivery.
We have, there's some situation where you find a child is born. We have those we call false teeth or plastic teeth.
Yes.
You find a child who is 2 weeks, that is 14 days. They have teeth, then you think those are teeth, but they are plastic teeth. They are also whereby you find when there is the age of eruption of the teeth, when they are starting, advancing stage, the child has the gum is not smooth. It's a bit swelling.
Yes.
You can see some reddish on the gum. You can touch the child, the gum, and they just push you away or they run away. So you find the gum itself, it's presenting not the normal pink pigment or color we normally consider as a healthy gum. So those are the signs or things makes you as a guardian to be able to say your child has an issue. Of course, they raise the temperature of a child. As I was saying last time, we have a gel we call Bonjela. Is the one we normally advise the parent, especially the mothers. We always advise mothers are the best dentists you can ever have. Reason is because they are always together with the children.
Yes.
They can know what is happening on their children.
Yes.
Then the gel can also have a soothing mechanism to make the child be able to eat or to be in a comfort zone.
Yes.
Yes.
You've talked of the plastic teeth. And sometimes during the first examination of the newborn, those are some of the things the midwives check. And sometimes a baby is born with teeth. Is it witchcraft? And what are they supposed to do?
It's a concept that most of the times for us in medical field, we tend to not to go on the line of herbals or the co-wives, midwife, sorry.
Yes.
So it's something that it comes, it always deals with how the two germs inborn were developing or were being interfered.
Yes.
For the midwife, we always say for the 6 months, for the first 6 months, a parent should take the child to be seen by a dentist or a dental officer.
Yes.
For anything to be detected. If those plastic teeth are there, then they are removed. Yes, we normally remove
But
them.
not at home.
Not at home.
Yes.
Yes.
Because we have
the child
seen-
is too young.
Yes.
You may end up traumatizing the child. You also may end up hurting the child. You may also have infecting the child because
Yes.
at a young age, the immune system is very low. Yes.
Yeah, because we have seen some tribes, they cut and remove for themselves. At the end of it, the baby dies because of sepsis or infection of the body. So you are warning the viewer that anything that is abnormal should be taken to the dentist.
Yes.
Okay, thank you so much for that, Daktari. Now, if I may ask, last week you were taking us through oral health, oral hygiene, showing us how to brush the teeth. Suppose all those are not done. What can happen to our teeth, to our mouth, to our body?
In dental, that's the oral health.
Yes.
There are conditions, all diseases that normally become as a result of not doing oral hygiene. Of course, we have what we call dental caries or dental cavities. It's whereby in a simpler way, you find your tooth presenting with a dark brown part, mostly on where you grind your food. So with time, then it forms what we call a dental cavity, which is a hole in a simpler language, whereby now once it's inside the tooth, as a person who has a problem or a cavity, then you develop sensitivity, you have a toothache. Then at the end of the day, you go to either to be done a procedure or an extraction. Then another condition which normally has relating with not doing oral health is gum disease.
Yes.
It results from what we call a tartar, and then it comes to a calculus. Those are black substances that are almost next to the gum. So they affect the gum. Once the gum is affected, it's become inflamed, it's swollen. Then the gum can present with reddish color. It's very flavish, very soft. Then you start having bleeding gum. At the end of the day, you now destroy the structure of that particular area and your tooth becomes an issue. Then also, of course, we have, if you don't do that, we have what you call oral trash. It is whereby you don't brush your tongue for some time. It can form some whitish patches on your tongue. Then if it's not, it can go to hairy. From there, it can result to other conditions. And of course, we have another one we call oral cancers. They are there. Most likely, we have the ones that normally happen for those mostly who smoke just below the tongue, under the tongue. When you find a wound has started developing slowly by slowly, because you don't take care of your health of the mouth, then it becomes an issue in future. And of course, there are so many. We have a manifestation of also HIV. It's also another issues, which normally, when you do oral hygiene, you can also detect what is happening in the mouth. And at the end of the day, you'll seek medical intervention that is from your dental officers. Yes.
Wow, that's very crucial information to understand that oral hygiene is very important. The brushing of teeth, I remember you mentioned something very strange, that it is better to brush your teeth even after
breakfast.
Yes, and that one was very key information, because I'm just imagining the gum, according to your demonstration, which you showed us last week, and you still have it here, the gum is pink in color. And you're talking of reddish color when it comes to inflammation. How do I differentiate?
This is just a physical, it's something you can look
Yes.
with your eyes. A pink and a reddish color, there is a demarcation in between.
Pink and red.
Pink and red,
Yes.
but not as red as the color itself. There is some slightly pinkish on it, but reddish is the pronounced one color now when it comes to the physical looking at it.
Yes.
And of course, when a gum is swollen, when you touch it, you feel pain. When a gum is swollen, there is also what you call abscess. Abscess is like a pimple, normally develop besides or under your tooth, just on the gum itself. You may think it's a pimple, but that's an infection that's already come from inside, then it has affected the gum.
Yeah, so that's very good, but I also wonder, what about men who also have the problem of colors to differentiate between pink and red? But that is okay. We understand now that it has to be abnormal look, which is reddish, swollen, and sometimes it's watery because of the inflammation process, the swelling that comes with it. So now a client has come complaining of all those signs and symptoms. And again, we understand there is pain. What do you do? How do you come with a diagnosis now? What are some of the things you do to say that this is a dental caries, this is this and not that? What are some of the things you do?
When a patient walks into a facility, first we have what we call history taking.
History taking.
History taking is whereby
collecting information.
Yes, and also you start from knowing first the name of the patient, and of course the gender. Then in the history taking, you want also to know if the patient has ever been having a recurrence of the same condition previously, if he or she has ever been seen by a dental officer or a dentist. And then from there you proceed to now asking the patient what he or she is presenting. Those are the cardinal points we start with. First, we deal with what has brought the patient. If it's the pain, now that's when now we look on the tooth. Sometimes patient can come with the upper feeling is the upper side has an issue, but it's the tooth that is on the lower side has a problem. They cannot differentiate. So that's when we now present the patient maybe to sit on the dental unit. Then we do what you call oral examination.
Yes.
Oral examination, you for a sensitivity, if the patient complains of sensitivity in terms of hot or cold drinks, then we pull the air. We have a pressure. You can just pull on the tooth just to blow the air, the cold air, to see which particular. Then, of course, we use what you call mirror and a prop. There's a dental prop. I wish I could have carried. It's an apparatus that helps you as a dental officer to tell or to differentiate which tooth has a cavity and which one does not have.
Yes.
Then, of course, there is what we call percussion. Percussion is whereby we take the an apparatus like a mirror, the other side, the opposite side of the mirror, where we normally a little bit hold the tooth, and then it's like we are hammering it. So that the patient can be able to say, no, this is the tooth that has an issue, but not the other one.
Yes.
Sometimes they don't know. So once we do that percussion, it's called in dental, then you can be able to tell this is the tooth has an issue. And of course, we have what we call X-rays. We have dental X-rays. They also help us to determine which kind of a tooth has an issue, which comes as a problem. And of course, X-rays, we have OPG, we have IOPA, we have bite wings. There are so many of them, depending on how the dental officer can be able to determine which kind of the best X-ray for that particular condition.
Yes.
Yes.
Okay. Do you do like blood samples?
No, we don't do blood samples.
We don't do blood samples, but can be done elsewhere.
What
in
we do-
relation to that problem of the teeth?
When we come on the issue of the blood is when in history taking, the patient can tell us he or she is anemia. That's now when we want to know the level of high blood.
Yes.
Yes, full blood count, so that we can know HB for that patient is how much. Because sometimes when you do an extraction, if the patient is anemia, they may have excess bleeding.
Okay.
So that's when it becomes, and of course when you want to have an extractional procedure and a patient from history taking is a diabetic patient. So also you want to know the sugar level on that
Yes.
particular. That's when now we come the aspect of blood sample testing. And of course, it's not us who does the work. We have lab technicians
Yes.
who comes and take the samples, then they can bring the results.
Wow,
Yes.
at least this is very enlightening to know that dental health is not a matter of walk in, walk out. There are some procedures that are done to come to a conclusion that this is the problem of the client. Wow, that is very important to know, because many are the times when we see so many dental clinics on the streets, everybody's writing on the notice board that extraction of tooth is 500. That's all. You find a very long queue, and in a day like 60 people have their teeth extracted within a period of less than 1 hour. How do you advise when it comes to seeking of health care in terms of dental health? How can we know where to go?
Of course, if you want to know which is the right facility,
Yes.
one is the out part of that particular place, the well design of that facility. Then of course when you come the inside, you have to see the license for that particular clinic. Is it
Yes.
licensed? Yes. Most of us, basically dental, we are licensed by Kenya Medical and Dentist Council. Yes, that's where you get your license from. And this license, of course, comes with your specification in terms of qualification. Those are the things you look as a patient or a client when you walk into a facility.
Yes.
Then, of course, how the arrangement of the clinic, you can see where your sterilization is. You can also see even how the dental chair is being presented to you, how you are seated, everything, even where you are sitting. Arrangement of the facility can also tell you, even the staffs themselves, how they welcome you, how they are dressed. It's one of the big factors. Even how you are being asked of a question.
Yes.
Maybe also called by your name. Yes, like now the other day we saw a patient being operated just because of a name, a wrong patient. So even that one, it is very key, you as a person when you walk in a facility. Of course, that custom care, it's everything to any person to work in any facility, how you are being welcomed. Now when also comes to the procedure itself, like in our place, we don't run for extractions. We normally advise other procedures.
Yes.
Like root canals, we normally advise for that. Instead of you removing your tooth, we always advise you, there is an option for this. You see, when you have time with your client, then also tells you as a patient that this facility is very well organized, and at the same time, they have that heart
Yes.
of dealing with you as a client.
Discoloration of teeth. Many are the times when we walk on our streets, we see like cleaning white teeth. Cleaning white teeth. And I have been wondering which kind of color is supposed to be cleaned, and which type of color is different. Well, we've seen people with discolored teeth, black, especially the molars and the premolars on top. We've seen even from the look, when someone smiles, you see there is the brown discoloration. Talk about discoloration of teeth and how you go about it.
Okay, thank you, Lucy.
Yes.
Discoloration by itself, the presentation, it can also be caused by the water, the borehole water. which we have what we call fluorescence discoloration, whereby some teeth they have some patches of white and others are brown. But when you find a person presenting the discoloration fully on a tooth, then it means that person, he or she, has a problem from inside the tooth. Now it's projecting outside. That's why now on such cases we advocate, even for the small kids, prolonged use of antibiotic also makes the permanent teeth has those discoloration. Then of course discoloration can be brought by poor oral hygiene, not brushing properly twice in a day. They can also resort to that. Of course we have a difference between teeth cleaning and teeth whitening. Teeth whitening is whereby we do many procedures on it if you want to make that discoloration to be solved. Of course, we have what we call tooth masking. It's where you paste, as I talked last week, with a white material. We call it composite. Then, of course, we have what we call veneers. Veneers, those are computerized that are made just on the outer part, not inside. Then, of course, we have what we call crowning. Crowning, they have a different aspects depending on the material you are using. And the most one common we use is we call it bleaching treatment, where we use what we call opalescence gel, the one that we use to make your teeth white. But always patient when they come to facility, they want whitening, but what they are presenting is what we call calculus. The black things just under and below the gum. That one is always dealt with just cleaning. We call full mouth scaling. For those, as you have said, who has black thing on top of the teeth, those are dental caries. And those are, we always advise patients to do fillings. Once you do a filling with a composite material, then your black aspect disappears. Yes.
And when you cover that black, have you solved the problem?
Yes, you have solved the problem if, as a dental officer practitioners, you have come to realize when you are preparing that tooth for that filling, the black aspect is not deep, it's just shallow.
Okay.
Because a tooth structure has enamel, dentin, and then the nerves and all the other structure. So once the black, which is the dental caries, is just on top, around the enamel, then you do a filling, you have sorted that patient problem.
Okay.
But if it's deeper than that, that's where now we advise you for a root canal.
Okay.
Yes.
In short, Doctor, you are telling us that discoloration of teeth as a solution.
Of course, it has a
People
solution.
should not feel like their smiling beauty has been denied.
Yes.
Yes.
They should not. In fact, they should be as quick as they can to their dental officers to any dental facilities. And of course, we have the one that has come right now, the most advanced one for teeth whitening, which I think takes like 10 to 15 minutes and your teeth are white. There's a machine has already come in the market. It has a ultra rays light. So once it has really on your teeth, you become white within 10 to 15 minutes.
Talk about the cost.
Of course, the cost for that one
is most.
The cost is expensive.
Yes.
I won't be very specific, but I want to give a range.
Yes.
Like teeth whitening, you can be done from 15,000 to 25,000. That is when you use the opalescence gel. Then, of course, if you have veneers are expensive. Those are computerized prosthetics, whereby one I think is between 10 to 15,000. Masking, most of the places they charge between 15 to 2,500 per tooth. Then
per tooth.
Yeah, per tooth. So if you are putting 6 up, so if it's 2,000, you times 6, that's around 12,000 Kenyan shillings, 12,000 and the lower. But we always discourage masking, because with time masking it always changes because of the eating. So if you had put the white part, then it becomes, with time it changes the color. So you find our clients putting the masking oftenly after maybe 2 or 3 years, you put another one. So that one we normally discourage. You do veneers, those are permanent solution. You can do teeth whitening, those are permanent solution. And also, of course, tooth whitening, it also depends on the habit as a patient. There are people who smoke, there are people who take a lot of alcohol,
Yes.
there are people who take mirrors. If you do whitening, again, you go back to the habit, still the problem will reoccur.
Recurs.
Yes.
Okay, thank you so much, Daktari, because many people face the challenge of teeth discoloration, and I'm sure now they understand that there is a solution,
There's always a
even
solution.
though they have to dig into their pockets. Does the NHIF cover that?
For NHIF, it does not cover because those are what we call cosmetic dentistry. It always covers the clinical aspect.
The clinical
Yes,
aspect.
only that. That clinical aspect is when you have a tooth pain, you want your teeth to be clean, the full mouth scaling, root canals. Those are the clinical aspects, the dental. The NHIF always covers. But for cosmetic dentistry replacement, braces, like teeth whitening, they don't cover that.
Okay.
Yes.
Okay.
Unless they have reviewed their decommission, then maybe it's
Yes.
in the pipeline.
Government facilities, do they take care of all those things you're saying?
Of
The
course,
teeth
yes, they do.
whitening, all those.
They
masking.
do. They do. They do. Because at the end of the day, government facility, they have qualified staffs.
Yes.
Yes. So I tend to believe and think they're also doing the same
They're
procedures.
also doing the same.
Yes.
Wow, thank you so much. You know, we have to understand because we are talking to viewers from all corners of this country, and they also need to understand where they can be able to get the care. Viewer, this is GBS TV Africa, and this is Health Talk Show. Today we are privileged to have a dentist in the house who has been taking us through the conditions that bother you and me in terms of dental health. Kindly continue telling us about pain. I know many clients come to you complaining of pain that has persisted maybe for years, which is acute, which means it has been there for few hours. How do you go about it?
Yes, thank you, Luz, once again. Pain is the most thing that brings somebody to the facility.
Yes.
If you don't have pain, then you cannot walk into any facility. When you're having an experience of a pain, we have acute and also we have chronic pain.
Yes.
Chronic pain is whereby it's a prolonged pain that maybe you take painkillers, it goes, then there is a relapse on it. Acute pain can be the one can come either you have taken a hot drink or a cold one. It's like a sharp pain that always comes on your tooth. There is another pain whereby your tooth is okay, but once you eat on that side, there is pain. Those are the conditions that you as a client or a person, when you hear that pain or you experience, that's when you'll be able to walk into a facility. There's also pain that can have from your head to the neck. That pain also it's something that is more like an emergency because it has to be dealt with. A person who is experiencing pain, of course they cannot sleep, they cannot eat, they cannot even go to work.
Yes.
So it means he or she has to seek medication. There is this notion whereby when you have pain, you walk into a chemist, you tell a pharmacist you want a painkiller and they give you. But as a dental officers, we always encourage you come to a facility because pain, once you have a pain, it means there is an infection. So pain goes along with an infection. So when you come to a dental facility, you are being given an oral examination and then the pain is always dealt with to know what is causing that pain.
Yes.
That's when now the dentist or the dental officer can be able to prescribe you a drug on that particular pain. There, of course, we have first liners, second liners, and third liners drugs. So it always depends on how you are presented that pain. There is that pain, we have even virtual consultation, which you can talk to your dentist over phone.
Okay.
There is that extreme pain which we normally advise patients they can go for what we call IM intramuscular injection, that painkiller or that drug where you are being injected to reduce your pain before you see your dent ulcer. Yes, and of course we have the most basic one, the Panadol, paracetamol. Yes, the most recommended one. Yes, and of course if a pain comes with an expectant mother, that's something that needs to be taken with a lot of care. Most of the times you find an expectant mother walks into a chemist because of pain. They are given strong painkillers, which we don't advocate for because of the pregnancy. So we normally advise and encourage, if you experience pain, kindly, if you cannot be able to walk in and you have a virtual consultation with your dentist, kindly do so, so that he or she can be able to differentiate and give you the right medication. Yes.
There is this special kind of pain that many clients have, such that, for example, when a spoon falls down on a cemented floor, somebody, even if he's in the bedroom, will have that pain on the tooth. Or maybe you're scratching a metal, somebody has pain, and that person is not the one scratching, is not even seeing you. What kind of pain is that? Is it imaginary?
Yeah, it's kind of an imaginary, because sometime, I think this month, we had such kind of a patient.
Yes.
I think she said she went to another place, she was given an injection for pain. But when she came and she presented herself and it was done a proper oral examination, we just encourage her, it's a psychological aspect. Yes, because you find like two knives scratching each other, you feel. For me, we always say that one is a psychological aspect. There is no pain associating with when you scratch two things at the same time. There is no pain, because pain, it has to come from an infection. Yes.
And David, I think you need some research for us, because you realize that it's not everybody. There are specific people in the population who have that. I may think that maybe scientists will tell us what the problem is. Now, how do you manage pain, especially if you know that this is the specific tooth which causes that particular problem? How do you manage?
When
Do you extract the tooth?
When a tooth has pain, first we look into the abscess aspect, the inflammation. And if the tooth is fully, has the full morphology, that's the shape, the tooth is fully, it's not, the crown aspect of it is not finished, then we can always advise you to do a root canal. Root canal is an endodontic procedure. It's done inside the tooth. Once you are done that particular session, the pain goes. That's the beauty of root canal. And it's a very friendly procedure, and a procedure that you cannot even have much issues once you have left your dental facilities. It's a very beautiful and a very conducive procedure. There are those who may present with grocery caries and they have pain, then we advise for an extraction. Yes, and also a pain can be as a result of a gum infection. Then you deal with the gum. You can advise for mouthwash, like there are many mouthwash, but there are 3 recommended ones. So those are the ones we always advise. Then of course we have antibiotics for gum issues. Then your pain can be able to be sorted out. So when you have a pain, once we know where the pain is resulting from, then we deal with it. Yes.
Talk about tooth extraction. At what point do you extract? Do you remove?
Tooth extraction, it has a variation of aspect of it. One, if you have overcrowded teeth, we normally advise to remove.
Overcrowded?
Yes. There are those kids who have teeth that are overcrowded, that they are not aligned. Then a tooth can be extracted to create more space for the rest of the teeth to align. Like what you call the first premolars, you can remove a tooth. That is not paining, that is a health tooth. It's always encouraged. It's part of aligning your teeth. A tooth can be removed. It has a presentation of grocery caries. It is finished. The crown, the natural crown, is already finished. It's the roots that have remained.
Yes.
That's when we encourage for a tooth pain. And of course, we respect the patient decision. If the patient, he or she, wants to be done an extraction and he or she has been advised for root canal and declined, and of course we have documented, then it can be done a tooth extraction. And also we can do tooth extraction on the last teeth, the wisdom one, which most of them, they are not done a procedure like root canals, depending on how their roots are. Most of them, we normally remove them. Of course, those are dispacted teeth. Most of them, they are inside the bone, so you can remove them. And of course, we also remove a tooth if it has what we call supereruption, where it has overgrown than the rest of the teeth. Now it's causing more harm to your oral tissues, like mouth sores. You have ulcers, and then we can also remove a tooth. Of course, also another thing is we can remove a tooth if your tooth is mobile, especially those people who are presenting with gum issues. It's beyond now. We do what you call throat extraction to create a conducive environment for the bone and the gum to heal properly. And then you can be done. We call denture replacement. Yes.
Okay.
Yes.
We've seen during accidents people with their tooth on the floor, on the road. Then it may be known specifically this tooth, for example, in a motorcycle accident, the passenger is only one, and we find teeth on the floor. Then we collect. How are we supposed to store? Are they important? Can they be replaced? Yes.
Yes, such scenario, how you store those natural teeth. One, we encourage any person who have involved in an accident or such, just under your tongue is the most conducive environment in the mouth. You can put your tooth under the tongue until you see your dentist. And of course, you become careful not to swallow.
Oh my goodness.
Yes, but that's the most conducive place that is recommended, under the tongue. And another one is if you have milk, you can store that tooth inside the milk. Yes. But if you have hauled your tooth from the accident scene to the facility and maybe your hands are dirty, then if it's going to be returned to be put the way, we call it the socket where it came from, then it may result to an infection. Yes. And we also encourage within 6 hours, if it's possible, that tooth should be returned to where it was.
Yes.
Yeah, initially.
Success rate?
Success rate, it is let's say 80 to 90%. It's successful, depending on how the dentist or the dentist has positioned that tooth.
Yes.
You find some, if they were putting back, they are not the same level like initially at the rest of the teeth, especially the front one. So you find that maybe your tooth is short or it's longer. That's when now we encourage, after some time where the tooth has now become firm and it's now okay, then you can do crowning to just level your tooth to the rest of.
Okay.
Yes. So it's successful and it can be well done. But once you bring it dirty, as much as they may try to disinfect the tooth. Of course, there are those natural aspects of the tooth by itself.
Yes.
You find you have already interfered. That's why you find after some time, a tooth has presented darkish. You find a tooth has started changing the color slowly by slowly until the whole tooth is darker.
Yes.
So we normally encourage those two aspects, under the tongue or inside the milk.
What is the process of getting dentures briefly, or the artificial teeth?
The artificial
Because we
teeth,
know there are so many people with gaps in their mouth and they may be looking for a solution. Maybe in 1 minute you can tell us.
for dentures replacement, we have a fixed and a removable. For the removable one, once you come to a facility, you'll be taken what we call a dental impression, whereby you take an impression of the particular aspect you want to replace the tooth and the opposing. Then you're given like 2 or 3 days, you come for your denture. But for the fixed dentures, which are crowns, they can take 5 to 7 days. And of course, those ones, there is what we call dental preparation. And of course, we have dental implants where we put the post or the screws inside the bone. Then you are going to done a replacement. So it always depends the kind of denture you want to be done. And of course, well advised by your dentist or a dental officer. Yes.
Okay, thank you so much for that. I just wanted to ask about the care of those now implanted teeth and the dentures. And for the implanted teeth, after how long should you expect very firm teeth that now it is as stable as the other teeth?
Naturally, in the mouth, we have grading of mobility of teeth. Even the natural teeth by itself, they are not fully firm. They are inside what we call a membrane. They are from grade 0 to grade 4 of mobility. So even the natural teeth themselves, they are not fully firm. They are in grade 0 or 2. So when you have an external force, that's when you have grade 1. A well-maintained dental implant, it can be as many years as you have it. What matters, even the natural teeth, it's how you maintain it. Yes, the dental flossing, well brushing, taking balanced diet, avoiding cracking of your teeth. Those are the aspects make you to have a firm dental implant. And of course, if it's the dentures, how you take care of them, how you clean them. You don't develop what you call secondary dental caries on the dentures, so that they don't bring infection the natural teeth. You avoid breaking them. Those aspects, all of them in one, then they'll make your tooth or the artificial one to be longer inside your mouth.
Wow.
Yes.
For the sake of time, maybe you can tell us, we've seen people with shiny teeth, looking like gold. Some wires running around the teeth. Kindly comment on that as you tell us how to store our brushes.
That aspect is of dental braces. And of course, on braces, we have fixed and removable braces. But the one you have asked more is of the fixed one, where you find there are some wires and what we call brackets.
Are they cosmetic or therapeutic?
They are cosmetic.
Oh.
Yes, but they are for treatment.
Yes.
Yes, it's a treatment aspect of it. Yes. There are those who put them just for the sake of beauty, but in dental, they are really for doing a treatment. Mostly it's aligning of your teeth. Yes.
Okay.
On the issue of the brush, toothbrush, how to clean, we are really encouraging viewers, when you have a toothbrush like this, it also depends on where you keep your toothbrush. Most people, they keep their toothbrush on the bathrooms, the toilets. We are really discouraging that, because once you bathe, maybe it was a hot shower, the steam always settled on your brush. So those are the things we always have to encourage anyone. How to keep your toothbrush, keep it in a well, far away from it, and at the same time, before you brush, run your toothbrush on hot water before you put your toothpaste, so that you can kill any bacteria that had settled on that toothbrush. Thank you so much.
Thank you so much, Daktari. Kindly give us your parting shot.
My parting shot, I can say, is that there is hope in dental, and there's a lot in dental that can be done. So we're encouraging viewers, it's good to seek your dentist or a dental officer twice in a year, which is very encouraging. Brush your teeth, of course, twice in a day, after dinner, then also after breakfast. Take your balanced diet, take a lot of water, and use a mouthwash once in a while. There are so many products in the market. Do dental flossing, which is the most key. Most people, they don't do that. Then avoid toothpick. They are not good. Thank you, and God bless.
Thank you so much, Daktari. It was a pleasure for us having you in this show, and we thank you very much. It has been very good conversation because the matter of teeth concerns everybody, children, middle-aged, elderly. We thank you for that. To you viewer, thank you so much for keeping it here in GBS TV Africa. This is Health Talk Show where we educate, we promote health. We have been talking about dental health, and I am sure you are going to help somebody. You're also going to help yourself, your children, and everybody around you. Thank you so much, and bye-bye until next time.